in the healthcare practice, in the healthcare field, is pretty prevalent. Unfortunately, it's a daily occurrence in our ER. It's a daily occurrence throughout the hospital. And I think there's many things that contribute to the violence towards healthcare professionals. People are there in their worst days. They don't feel good. Some people have mental health issues in that, they're not on their meds, or they're using drugs, or they're scared. And sometimes they lash out at the healthcare professionals. So it's actually more common than people think. In the ER and throughout Renown, we prepare our healthcare workers for verbal abuse and physical abuse. Unfortunately, there's classes that we have them go through when they start working at the hospital. And then we continue to do education throughout the year. And then we work on programs that we can help educate our staff to help de-escalate the situation. We have security who's there for us in the ER as well. And we talk a lot. We talk about things that happen. If you're getting verbally abused or physically abused, we have a period where we de-escalate in that moment. And then we come together as a team and just make sure that staff member is okay, because when you go into the healthcare profession, you don't think that this is going to happen to you. You don't think that people are going to treat you not very kindly or try to hurt you. So we make sure everybody's aware that yes, this can happen, but we're here for you if you need it. We have a violence prevention task force, and they will respond to those events as well, just to round back with the employee and the staff involved. If they feel like they need to go home, we make sure they're okay, and we give them that day to kind of process what just happened. And then we offer resources to them if they feel like they're having a really hard time processing what's going on.
It's so difficult to have to worry about violence in the workplace. And while that's relevant for every industry, it's particularly troubling when you come to a building where people are trying to help others in healthcare and violence rears its head. Here at Renown Health, we unfortunately have a long history of understanding what this means. We had an on-campus shooting here 8 years ago, and each day I continue to think about our open spaces and where we walk and who else might be walking through those doors with ill intent, and how that puts our employees and our physicians at risk. I believe so much in this cause that I actually volunteer my time as a member of the American Hospital Association Hospitals Against Violence Steering Committee, where we try to help understand and execute for hospitals across the country, member hospitals, what they can do to understand this problem, prevent this problem, or deal with the aftermath of these problems when they occur, because they are invariably occurring.